Welcome to the month of Pink October. As pink suggests that it is a month devoted to women, especially awareness in breast cancer. But do you know that breast cancer also affects men? And this week we're going to focus on differences between men and women's breast cancer. You may be aware that the statistics of 1 in 100 breast cancer actually happens in men. And in fact, it's true. But that translates to 20,000 men who suffer from breast cancer worldwide. And that's 20,000 men who really need that attention. So exactly why does this happen? We actually don't know. But there's a lot of risk factors that are associated with breast cancer, and most of them are hormonally related. There's a genetic condition, one of them is called Klinefelter, or if you are unlucky to have XY gene that will have additional X genes, then you're more prone to getting breast cancer. There are other reasons why people are more prone to getting breast cancer, and that includes anything that to do with suppression of your testosterone. And for example, people who has got testicular dysgenesis, that means that the testicle is not functioning well, if it's not producing hormone, if it's also not producing sperm, and that reduction in productions of hormone will put you at risk of getting breast cancer. So therefore, other conditions such as mums or actually undescended testicle may make you more prone to breast cancer. Other things such as gynecomastia, which is enlarged breast in men, is a chicken and egg situation. We don't really know whether it's cause or effect, but we know that it's associated with breast cancer. A few things that actually has been thrown about male breast cancer. It was worried that men probably are not aware of getting breast cancer, therefore delay in its diagnosis. And the taboo of men getting breast cancer is probably delaying men from seeking treatment. But that itself does not translate to men presenting late with more aggressive cancer. However, thankfully, the statistic doesn't show so, because one big study looking at the presentations of breast cancer, it shows that about 45% of women presented with locally confined disease and about 63% of men presented with locally confined disease. However, one of the things which is very strange is that breast cancer is more likely to affect both breasts in men, and then that is slightly increased from comparison with data in women. The reality is that because they are so rare to see breast cancer in men, the statistics and the studies are all retrospective study and there's no prospective study. Therefore, we hope in the future, when it comes to Pink October month, we would have a small portion of men actually get a bit more attention and awareness in the risk of getting breast cancer in men. In keeping with breast and in keeping with men under Dr. G on the spot, next week we're going to talk about gynecomastia. If you want to find out, or if you want to find out for your friend, then perhaps you want to stay tuned for next week's Putting Dr. G on the Spot.